Hi there, and welcome back to Wellness in the Low Country. I'm Dr. Gupta. So before we left off for our commercial break, we were talking about surgical forms of weight loss. So let's shift a little bit. Surgical forms of fat loss. The most common one out there is a procedure called liposuction. What is liposuction? This is when a surgeon will go in and through an incision literally suck out the fat from just underneath the surface of the skin. We have two types of fat. I'm going to show you a diagram here. Let's go to this diagram on the screen. What you're looking at here is on one side you have the image of a man, on the other you have the image of a woman. What both of these diagrams show is we actually have two types of fat. Not all fat is equal. Just underneath the surface of the skin, you see that labeled there, it says subcutaneous fat. As you're looking at that layer, then deep to that or behind that are our abdominal muscles. Behind the abdominal muscles, behind the rib cage, surrounding all of our vital organs, our heart, our lungs, our diaphragm, our kidneys, our pancreas, everything is what's called visceral fat. Now, let's break away from that diagram and I'm going to show you a couple resources so you're not taking my word for it. Again, I don't know everything, you don't know everything. Let's go to people who do know more than we do. This is an article from Harvard Medical School and I'm just going to read it to you. Harvard Medical School says, excess body fat contributes to major causes of death and disability, including heart attacks, strokes, high blood pressure, cancer, diabetes, osteoarthritis, fatty liver, and depression. Faced with these risks, it's no wonder that you want to know how much you should weigh, but this common and important question is actually the wrong question. For health, the issue is not how much you weigh, but how much abdominal fat you have. This is supported further by article done on belly fat by the Mayo Clinic. Mayo Clinic says excess visceral fat, that dangerous fat that lives behind the rib cage, excess visceral fat, even in people with a healthy BMI, is strongly linked to elevated blood sugar, high blood pressure, high cholesterol, fatty liver, and inflammation throughout the body. These factors fuel the development of heart disease, liver disease, diabetes, and cancer, increases your risk of premature death. In contrast, fat stored just under the skin, that subcutaneous fat that we were talking about, is not as damaging. Okay, so what does this mean for us? Well, liposuction, first and foremost, understand this. We don't get more fat, okay? We're born essentially a little bit after adolescence. We have all the fat our body is going to have. What happens from that point on is the size of those fat cells. So as we eat more, those fat cells can get bigger or those fat cells can shrink. We're not producing more fat cells, all right? So what happens with liposuction? It's a surgical procedure. We go in, and when we do this procedure, we can't cut behind the ribs. We're not going to the heart and those vital organs. We can't touch visceral fat. So we go in and we suck out some subcutaneous fat. Now, we already heard from Mayo and from Harvard that this is the fat that actually has no health consequences to us. Second most important fact, fat cells serve a purpose. We store toxins in fat cells. They serve a purpose with our body's temperature regulation, and we only have stem cells in two parts of the body, our fat cells and our bone marrow. So if I go in and I artificially, surgically suck out some of the fat cells, my body is going to blow up in size the other fat cells in and around other areas, sometimes even the areas immediately surrounding that, because it needs that storage space. And this is why most people who have liposuction will say, you know, it seemed to work for a while and after they got past the pain and the scarring and the healing, but then the fat seemed to come back. Well, that's why. That's why that happens. So that's the surgical form of fat loss. What are non-surgical forms of fat loss? Well, there's two different ways to do it. You can kill fat cells or you can shrink fat cells. We've already touched a little bit on the dangers of killing fat cells and why you don't want to do that. Let's talk about a couple ways that you can. There's laser assisted or RF assisted, meaning they're using a form of radiation, kind of like the radiation that comes from your cell phone. We all know that radiation is bad. What do we use radiation for? Well, we use radiation to help kill cancer cells, right? Radiation and chemotherapy. Radiation kills cells. This is one form that they are using. And any of the laser forms that you see are working with this. These are things like Sonabella, M-Sculpt, TrueSculpt, LightRx. These are just some of the examples of what is laser-assisted liposuction, or I'm sorry, lipolysis, laser-assisted lipolysis. So they're killing fat cells. Again, I personally, as a physician, don't recommend killing fat cells because they actually serve a purpose and they tend to come back. And that's aside from the pain and the scarring and things like that, okay? When we do this, these fat cells are now dead, they're gone. We've lost space where we can have stem cells, we've lost space where the body stores toxins. And what else happens? And this happens in both forms of ways to kill stem cells. So the other form is freezing the fat cells. A common form or way that you'll probably hear a lot about in doing this is what's called cryolipolysis. Cryo meaning cold, lipo meaning fat, lysis means kill. The most common one of this is cool sculpting. So again, aside from the fact that this is only for subcutaneous fat, it's not doing anything for visceral. Aside from the pain, the bruising, the scarring, and you can pull up complications of cool sculpting on your website, and it's amazing what's out there. But what happens with this? You suction some of that fat, you cryo inject it, to freeze it, to kill it. These fat cells now, as a surgeon, no surgeon's going to go in if you have a bad appendix and they're going to tie off that appendix and then leave it in there. Or you've got a really bad gallbladder and they go in and tie it off so that it dies and then leave it in there. What happens? That organ then necroses. It withers away, it rots, okay? And it releases toxins when it does that. Fat is no different. When we use a laser or radiation or freezing techniques to kill fat cells, they're not removing it. All right, you're not being cut open. These are all superficial techniques that they're using to kill the fat cells. Guess what? Those fat cells are inside the body rotting, and it's releasing toxins. Remember, toxins are stored in our fat cells, so now we've killed the storage space, or some of the storage space, and we've added the toxin load. So the other fat cells have to blow up to store these toxins. Plus, it's a 1 to 3 month period, a load on the liver, our body's detoxifier, to try and help clear those toxins that we just created because we artificially killed a part of our body and left it in there. You got a rotten tooth, you don't go to the dentist and the dentist says, okay, let's just leave it in there. You take rotting things out of the body so it doesn't produce toxins. This is my take on killing fat cells, whether using laser to do it or freezing techniques. So what's the alternative to killing fat cells? Well, we can shrink them. We can shrink fat cells. This is where LED light technology comes in. And LED light technology has been around for a couple decades. LED light technology actually has a lot of benefits to the body outside of fat loss. It's only most recently in the last few years been used in the fat loss realm. It was being used for years in the skin realm, in the anti-aging world, in pain reduction, for rehabilitation. What happens, one of the benefits of red light technology, and I should say also, red light technology has been out there for a long time, but there's lots of different frequencies, wavelengths within red light, ranging from infrared to all the way to the other spectrum. Not all red light technology is the same, and that is very important to understand because you'll see all sorts of things out there on the web. Here's this handheld this or that or the other, and none of these have been clinically proven or guaranteed to have an effective result, except for one of them, and I'll get to that in a moment. So red light technology has been used in the anti-aging world because there are a lot of benefits to it. And I want to put this visual up on the screen for you to look at. What this shows is benefits of red light technology, and what you can see here, minimizing wrinkles, fine lines, reduces crow's feet, improves skin tone. How does it do that? Well, red light technology activates what's called fibroblasts. These are cells in the skin that create collagen and elastin. This collagen and elastin, these are proteins that improve the body's skin turgor, your skin tone, your elasticity. Red light technology has been shown to increase blood flow, help with regeneration, circulation, photorejuvenation, creates more skin moisture, improves your circulation, reduces the pore size of the skin. You can read the list on there. One of the other biggies is detoxification. Toxins are stored in our fat cells. If you don't do something to detoxify, you won't have a successful fat loss result. This is another area where diet and exercise fail us because we're not doing anything to detoxify. So, what is out there that can work, that can do all of this? In my research, speaking as a physician, I have found that fast-fit body sculpting is a very effective way using LED light technology. So one, that means we're not invasive, we're not going for any surgical procedures, there's no recovery downtime. Two, it means that we're not killing any fat cells, we're shrinking them. Three, it is the only technology that has been shown to not just address subcutaneous fat, which every other procedure we talked about only deals with subcutaneous. It's the only procedure that has been shown, or the only technology that has been shown to affect visceral fat as well. All right, I think this is a lot of information from one sitting. Hopefully you got a lot out of it. My recommendation, don't kill things in your body, shrink fat cells, do so naturally where you can get a lot of benefit. Thanks for being with us today on Wellness in the Low Country.